Hello dear patients and our followers, I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic, Istanbul, Turkey. Today we are going to evaluate the patients who underwent a patient who underwent a hair transplantation surgery in our clinic 18 months ago. It was March of 2023. It's a 31-year-old male patient with the neurotype 4A of the hair loss. When we evaluate the patient for the hair restoration surgery, the first thing we do, we always stage or grade their hair loss pattern. Or male pattern baldness in general, it's staged from grade 1 to grade 7, and there is a special scale called a Norwood-Hamilton scale to evaluate them. And on Norwood-Hamilton scale, the patient is graded from stage 1 to stage 7 of the hair loss, 1 meaning the least, and 7 meaning the most of the hair loss. And the higher is the degree of the hair loss, the higher is the demand or the number of the grafts the patients may need to meet their expectations. So the patient had the neurotype 4A of the hair loss. What does it mean? First of all, it means the loss of the continuity of the front hairline, an empty spot on both temples, front forelock is open, front third is open, and the mid-scalp transition to the crown area has some thinning or degree of the hair loss. For this type of patients, on average, you may need the numbers varying between 3,000 to 4,000 grafts. Of course, number of the grafts vary from patient to patient, depending on the size of the open area, the density you want to get, expectations of the patient. One of the questions we most of the time get from our patients saying, what's the density you go with for the patients? Actually, there are some rules, but one of the main criteria is when adjusting the density for the patient is the general density of the hair of the patient himself. Why? Because if the patient has a really good density and you go with the standard density of, let's say, 40-50 grafts per centimeter square, this area will look slightly thinner. Or if the patient has a thin hair, or you go with the high density of 40 to 50 grafts per centimeter square, this time this area will look like a mushroom with more density here, slightly less to the back of the head. So the general density should meet the density of the patient's own or non-transplant hair, so it looks much more natural as a result of the surgery. So the patient was transplanted in total 3,700 grafts. What we did the reconstruction of the front hairline, marked the areas that need to be transplanted, and according to the patient's expectations, did some marking in the crown area. If the patient needed it, when we look at the magnifying surgical loop, we wanted to add it to this area as well. But during the evaluation of the magnifying loop or surgical loops, what we saw that the density there was good. So let's say when we can do the transplantation to the areas, let's say these are the hair follicles that grow close to each other. When you lose one of them, there is an empty spot. So we can put one hair here. But every once in a while, this area may look thin or empty, but not because there is a hair loss. The reason maybe the hair is losing its volume. It's called miniaturization. So it's not actually the hair loss, but the thinning or loss of the volume. And this area looks thinner. And if we try to do the surgery here, trying to push it to the area where the density is good, there is a high risk we're going to damage the adjacent hair follicles. So when trying to implant one hair, you can damage 2 or 3 of the patient's own hair. So we have to be very, very careful about this one. And that's why most of the time, or predominantly during the surgery, we use this surgical loop so we can see the area much better. So the patient, as we have mentioned before, was transplanted 3,700 grafts. Out of this 3,700 grafts, 2,900 of them was densely packed in the front area, and 800 was transplanted to the mid-scalp transition area. Here you can see the results of the patient almost like 18 months after the surgery. The main idea of the surgery, the restoring of the front hairline of the frame of the face, is done. The patient has a good density in the front side and the mid-scalp, and overall outlook looks really nice. The patient is happy, we are happy. It's one of the aspects of the surgery. When the patient becomes happy, it motivates us to work even harder. As a general rule, our patient experience team with the specific time frames ask for the pictures of the patient so we can see how the progress or the dynamics of the hair growth and regrowth goes on. We ask the patient to send us the pictures 2 weeks after the surgery, 1 month, 3 months, 6 months, 12 months, and 18 months after the surgery. And here on the pictures you can see how all the time the dynamics of the hair growth, shock hair loss, and regrowth and improvement of the hair goes. And that shows us that the hair transplantation surgery isn't a very short, immediate result surgery. It's a game of patience, and it needs some time to show off its final result. Thanks for watching, stay tuned, and if you have any questions, you can always leave it in the comments so we'll be able to answer them. Good luck.